Good morning. Good morning. My name is Camilla Worrell, and I am the executive director of the Women's Fund of the Greater Cincinnati Foundation. And I am so grateful to everyone who is joining us on their lunch hour to learn more about self-sufficiency here in Ohio. Um, Before I get going, I do want to talk a little bit about today's program and just talk a little bit about some housekeeping matters, I think, as people are continuing to join us. This is our webinar about the Self-Sufficiency Simulator, which will be live on our website. Again, my name is Camilla Worrell, the Executive Director here at the Women's Fund. We will be recording this webinar in case it'll be available later for everyone. And if you want to share with people, I'm sure it's going to make your greatest hits list because we're going to have lots of great information. We invite you to use the Q&A feature. If at any time you have questions, and we're going to do our best to answer all of those questions here during this webinar, but due to time constraints, if we don't get to all of them, we will be sending a follow-up email later. We have featured guests today who will be going through the ways in which we've all been talking about. We think this self-sufficiency simulator will be helpful, again, to give everyone an idea about how it will be used. And our agenda is really to allow Dr. Travis Spees to demonstrate the tool and allow you all to see the different ways that we can use it. I'm going to take a little moment of privilege to say something about the Women's Fund. We're celebrating our 30th anniversary this year, and we've been reflecting on our accomplishments in the community. Our Women's Fund is unique in that it sits within the Greater Cincinnati Foundation, and we've really benefited from the generosity and support of that foundation, its leadership, and the board to branch out from grant making and really look at finding solutions in different areas of need. What we call our success equation is utilizing ways to achieve a community where all women can participate and prosper. We've really leaned into driving systemic change through advocacy and civic engagement, and have had two incredible staff members in those areas who are on this call, Holly Hankinson and Rajani Menon, leading the charge. But we are also one of the region's experts in women's economic self-sufficiency, and have released research since 2005 on data highlighting what it is like for women in the greater Cincinnati region. We've always made our research available to stakeholders and to our community partners, and have listened to feedback on ways that we can make this high level work more accessible and easier to understand and use. Our very own applied research director, Dr. Travis Spees, really leaned into this challenge of making data more accessible, and thus the self-sufficiency simulator was created. Our hope is that it is a tool that is used by Ohioans, and that it is part of the conversation people need to have around wages and where we hope to see wage levels move towards, i.e., catalyzing the community towards understanding and support of this issue. I do want to thank GCF and the Charlotte Schmidtblatt Foundation at Fifth Third Bank for helping to fund our research efforts. And see, I've started. I know that while I've captivated you so far, I'm doing it again. I'm talking too much. And so I want to introduce you to the person that you really came here to hear from, and that is Dr. Travis Spees.
Thanks so much, Camilla. And good afternoon, everybody. I'm really excited to be presenting to you this latest work from the Women's Fund. The Self-Sufficiency Simulator can help us to understand the financial needs of families in Ohio and to really better equip us with information to make data-driven decisions as we develop strategies to enable families to be upwardly mobile. Now, the Women's Fund has been doing research on women's economic mobility for nearly 20 years, and it's really been the foundation for our advocacy efforts. Reports on pay equity and the cliff effect have led to policy changes that promote the self-sufficiency of women and families. And our work on the cliff effect in particular has guided the way that we think about the importance of being self-sufficient. The cliff effect is when small increase in a person's earnings results in their ineligibility for certain public benefits like healthcare or childcare, which results in a net loss of resources. And so this is significant, especially for single mothers who have to balance their work and parenting responsibilities simultaneously. The cliff effect disincentivizes individuals from being upwardly mobile because as an individual grows more successful in their career, they experience financial setbacks that affect not just themselves, but their entire families. So let me show you what this looks like. This graph, which comes from our 2020 cliff effect report, illustrates the dynamics between annual earned income and the array of varying social assistances for a household with one adult and one preschooler in Hamilton County. As the annual earned income increases in green, the total gross resources represented by the black dotted line remains relatively flat due to social assistance programs phasing out and declining in benefit dollars provided. So unless a household is making more than $40,000 a year, or about $20 an hour working full time, there really aren't significant impacts on its gross resources despite career advancements. The adult will transition from Medicaid to Affordable Care Act at 138% of the federal poverty level, causing a slight cliff that you can see here. The total gross resources are relatively stagnant from about $16,600 to $38,000. This equates to earning between $8.30 and $19 per hour at full-time work. So between $16,600 and $38,000 in annual earnings, the household's total gross resources increase only by $4,500, which is an 11% increase. But their annual earnings increase by about $21,000, or a 130% increase. So until the single parent household reaches approximately $20 an hour, their total gross resources are just not increasing at the same rate as their annual earnings. So please now let me introduce to you our self-sufficiency simulator. I am really excited to be walking you through this powerful tool that is really designed to help us better understand what it takes to make ends meet across Ohio. As we mentioned earlier, the Self-Sufficiency Standard provides a detailed picture of a family's expenses. It considers where a family lives, the number of people in the household, and the ages of those household members. This allows us to see how costs vary based on family composition and how living expenses differ between urban and rural communities. We encourage users to approach this tool with curiosity, using key questions to guide their understanding, like, is a minimum wage job enough to cover basic expenses in my area? Or how much do I need to earn to be self-sufficient? Or if I'm an employer, am I paying my workers enough for them to make ends meet? Now, it's important for us to remember that this tool provides an estimate of the income needed to cover essential expenses without relying on public benefits. This isn't about financial comfort, it's really about the bare minimum required to get by. For instance, the food budget in the Self-Sufficiency Standard is based on the USDA's conservative low-cost food plan. That means it only accounts for home-prepared meals, no takeout, fast food, or restaurant dining. So with that, let's dive in and explore what Ohio's Self-Sufficiency Standard is. Here, you'll see a heat map of Ohio's 88 counties. The lighter colored counties have a lower self-sufficiency standard, while the darker counties have a higher one. So right now, we're looking at the self-sufficiency wage for a one adult, one infant household. And we can see that in Hamilton County, where the Women's Fund is located in Cincinnati, a single parent with an infant needs to earn $62,567 per year to be self-sufficient. And that breaks down to a monthly budget of $5,214 or an hourly wage of $29.62 when working full time. So we can compare that to Henry County, where the same family would need $43,527 per year, or about $20.61 per hour. Now, the average family size in Ohio is about 2.4 people per household. So let's adjust our scenario to look at a different family composition. Let's do 2 adults with 1 preschooler. As you change the family size, you'll notice that the map updates automatically to reflect the new selection. So for a 2-adult household with 1 preschooler in Franklin County near Columbus, the combined income needed for self-sufficiency is about $80,000 per year. That means each adult would need to earn about $19 per hour. But what if we look at a single parent raising 2 children? Let's say a preschooler and a preteen in Franklin County. That parent would need to earn over $84,000 a year, which is more than $39 per hour. So across all of these examples, you can start to see a pattern. Darker colored areas tend to cluster around cities like Cleveland, Columbus, and Cincinnati, where the cost of living is higher. So this heat map gives us a big picture view of self-sufficiency, but let's shift perspectives and look at this information in a different way, asking ourselves, how much do I need to work? So now we are looking at the number of hours a person would need to work if they were working at Ohio's minimum wage to be self-sufficient. And now we have the most recent 2025 data, so we use Ohio's minimum wage currently at $10.70. In Hamilton County, a single adult working full-time at minimum wage would need to work 62 hours per week just to reach self-sufficiency. Alternatively, they'd need to find a job that pays at least $15.09 per hour to make ends meet with a standard 40-hour work week. That's $4.39 more than the minimum wage. Again, this page is interactive. So while the self-sufficiency standard includes more than 700 different family types, we've pulled out 10 sample families here to illustrate these numbers. But let's take a look at Erie County in north central Ohio. Here now, a single adult would need to work 54 hours per week to be self-sufficient. And even in a 2-adult household, both adults would need to work a combined 81 hours per week to make ends meet. And when you add children into that mix, a single parent could need to work up to 125 hours at minimum wage to cover their basic expenses. Now, that is more than 17 hours per day, 7 days a week. And there simply aren't enough hours in the day to work, parent, and sleep. The reality is that in every single county in Ohio, a minimum wage job is just not enough to support a family on a standard 40-hour work week. So at this point, you might be wondering what exactly goes into the self-sufficiency standard. How do these contribute to the family's overall budget? Well, on the next page, we'll break this down by a monthly budget for different families in any county in Ohio. So here we can explore those different expenses to see how changes in family composition or location affect the overall cost of meeting a family's needs. This tool also allows us to compare different counties side by side. So right now we are looking at comparing Hamilton County and Adams County. And Adams County is just 3 counties east of Hamilton, but as you can see, the overall costs of self-sufficiency for a 1-adult, 1-infant household are noticeably different. And we can also break down the budget costs into different segments, looking at both the big expenses like housing, childcare, and healthcare, as well as the smaller but essential expenses like broadband, transportation, and food costs. So if you prefer to see these expenses as a percentage of a family's budget, just hover over the expense in the graph. And you can see for this family in Hamilton County, childcare alone makes up more than a quarter of their monthly costs. Now, let's think about this information in another way by looking at how much a family's income might fall short if they were earning a minimum wage salary. By hovering over the chart on the left, we can see that this family would fall short of their monthly self-sufficient budget by about $3,600, which adds up to nearly $43,000 per year if they were only earning $10.70 per hour. And again, this simulator is fully interactive, so you can compare different counties by adding or removing them from this drop-down menu. You can also change the family composition using the drop-downs, just like you did with the map feature. Now, if you are still curious about how these expenses are calculated and you want to know more, you can click on either chart and follow the link to learn more. And so here, you'll see what's included in this other necessities category and what isn't. For example, this category doesn't include entertainment, recreational expenses, or even saving for the future or paying off debt. You can see also some information about taxes and tax credits. And if you want to dive even deeper, we've included a link to the Center for Women's Welfare at the University of Washington, where you can learn more about Dr. Diana Pierce's methodology in creating the self-sufficiency standard. And so this is our self-sufficiency simulator. We really believe that this is a powerful way to visualize complex economic realities. But we've also included some additional resources on our website, such as specific recommendations for employers, policymakers, and community members. We think that these guides can really help users to activate this information in ways that support economic security and opportunity based on their role. So now I would like to welcome our guest speakers. We've invited them to share some of their insights from their work across different sectors to discuss how the self-sufficiency simulator and other tools like it can support their efforts. I'll introduce each of our guests individually and ask them a few questions about their areas of expertise, and then we'll open up the conversation to a couple of different group questions. And if you'd like to submit a question for our panelists, please just use the Q&A button at the bottom of your screen. So first, I would like to introduce to you Gladys Ahovey, who is the Vice President of Good Communities, Impact and Investments at Ohio Valley Goodwill Industries. Gladys and team are on a mission to eliminate barriers and empower individuals to create a vibrant, sustainable community where everyone has the opportunity to make an impact. Gladys, thank you so much for being here with us today.
I'm thrilled to be here with you. Thanks for inviting us, Travis.
Of course. So now I know that Goodwill Industries is really active in many different initiatives in addition to the retail centers that you operate. Could you tell us a little bit about the workforce development programs that you're engaged in and how these kinds of programs play into promoting self-sufficiency?
Yeah, absolutely. I mean, I think what you all have been working on and are announcing today, making it available to community, is a really critical resource. At our organization, Ohio Valley Goodwill, we have been centrally focused on workforce development since our inception. The whole basis of our business model is to help individuals through incredibly difficult times, typically related to some sort of economic downturn, and figure out how do they learn, earn, and become more self-sufficient. So we've been operating a range of programs, primarily rooted in supporting individuals with physical and intellectual disabilities to become more active and full-fledged participants in their local communities. That has extended to supporting veterans as they're navigating housing issues and accessing and maintaining work. And it's broadened even further to supporting individuals who have been justice impacted, young people entering the workforce for the very first time, and working families, in particular, working moms, and their ability to navigate childcare challenges and the impacts of those on their ability to secure and retain work. So we've been working on a variety of areas, and just recently we've decided to really narrow our focus into the three areas where we have the greatest expertise and have the ability to provide deeper support. And that is in workforce development through our Good Works pathways, shelter and supportive housing through our Good Support Housing Initiative, and independent living and community participation with our Good Life Services for individuals with developmental disabilities.
Thank you, Gladys. I know that I personally have really enjoyed over the last couple of months getting to learn more about Goodwill Industries and touring your facilities and seeing all of the incredible work that's being done there. How does financial insecurity impact workforce participation and job retention? Do you have any advice on how employers might use tools like the Self-Sufficiency Simulator to understand the financial realities of their workforce?
Well, I mean, I can give you a really practical example, Travis. I mean, Goodwill is a service provider, of course, but we're also an employer. And we have several retail stores as well as donation centers all across the Ohio Valley area into Kentucky and into Indiana. And a continuous challenge that we have when trying to connect individuals to opportunities within our own business is sometimes people can't even afford to get here for their first day of work. They've done everything that they can to make it to the interview to meet, but when they need to come into orientation, they don't have the transportation. They may not realize that where they need to go for orientation is different from their day-to-day work location. And sometimes they have to make a choice. Do I pay the taxi fare there and back for the day, or Uber fare, or pay someone to take me? Or do I cover lunch for the rest of the week? Do I pay for my kids' activities for that week? Do I finish grocery shopping that week? These are very practical challenges that we have experienced as an employer ourselves. And so tools like this are really critical because now we have a better and more systematic way of taking a look at where are people coming from, what potential challenges might they encounter, and how do we shore up support to support them through the process. We have had folks quit jobs in order to be able to get that final pay earlier than the scheduled payroll date in order to be able to cover their rent for that month. But then what happens next month? And so the range of information that people are using to make some really critical, time-sensitive decisions driven by financial insecurity is showing up in ways that is compromising their ability to retain services, to retain jobs, no matter how much support that they have. So it's a very real and practical problem, not just from a service provider standpoint, but just from as an employer. People want to work, but they're facing very tough decisions. Sometimes decisions we don't understand and we might not make, but we're not in their shoes. And so this simulator, I think, really helps us look at this in a practical way and to inform the kinds of decisions and supports that we also can put in place for people.
Yeah, thank you for sharing that. It sounds like even before you understand the decision-making process that employees have, employers have to be ready to listen to their employees and seek that information and have those conversations to understand where they're at. Thank you for sharing that. Now, I know that you recently released results from Ohio Valley Goodwill's Community Needs Assessment Survey. Could you tell us a little bit more about how other organizations might use data like this or the self-sufficiency data to design more effective programs and services?
Sure. I think we talked about this at our recent launch as well when we introduced our new Gated Communities initiative, and it's really coming out of a process that we undertook with the Community Needs Assessment. Every organization needs to do its due diligence to make sure that its services remain relevant, but it's a costly venture. We were fortunate enough to do it through partnership with Children's Hospital as well as Goodwill International. But I think the benefit to other organizations is the fact that it has been done. And they need not start from scratch. Partnering with organizations like yours, looking at all the amazing research you guys have done in the space of the benefits cliff and its impact and the wide range of interventions. Organizations don't need to start from scratch, nor do they need to start in the dark. I think engaging in conversations like this really helps to inform and identify a starting point. That's one of the things that we did, in looking at the impact of the benefits cliff on us as an employer when it comes to recruitment and retention. And also just engaging in conversation, reaching out and taking a look at what's been done so far to better identify where they can start. In our particular case, the community needs assessment really validated three things that we were seeing on a day-to-day basis, but it had no scientific proof that this, in fact, is a major issue and therefore somewhere we should spend more time. The intersection of challenges between transportation, affordable housing, and childcare affordability, but also childcare accessibility. Even if it's available, it's full. Even if you have a center close to you, it's full because there's a workforce shortage and workforce challenge in that sector in and of itself. So the intersection of these three things showed up loud and clear in our community needs assessment. And it told us that if we want to continue to meet the needs of community, regardless of where we are, and we did look at our full portfolio, we needed to pay attention and do something about the impact of these three things. We needed to do a deeper dive on how are these three things impacting our ability to recruit across a variety of positions, retain people beyond 90 days, and also same issues in terms of people being able to access and remain in service for programs. And so, I think leveraging research, assessments for communities, community impact reports, and shared impact reports by other organizations is really, really important. It is a luxury to have a full data analytics team in a nonprofit organization. And so I think we're really fortunate to be able to lean on organizations like yours, Travis, to help us better understand data that's already available and research that you're working with so that we can apply it in practical ways in our organizations.
Yeah, thank you. It sounds like when the challenges are intertwined, the solutions have to really be created collaboratively across different organizations. So I've got one more question for you, Gladys. How do you see tools like this being able to help organizations communicate their financial need to fund their programs, right, through different funding sources or policymakers?
I mean, I think the tool is pointing us to evidence. And I think we're increasingly in a time where evidence-based approaches are probably more important than ever right now. And it also gives us a different type of language to use, language that's embedded in economics. And again, that seems to be, kind of the cause of the day, really making the case and speaking to how is what you are doing going to contribute to the economic self-sufficiency of your community, of your neighborhood, of your city? I think the simulator gives us that language, which is not necessarily part of our everyday language in the space of providing direct services. It speaks to numbers, it speaks to averages, it speaks to need, but it canvases it with taking all the different elements into consideration. In my experience, we, as service providers, we spend a lot of time trying to get people to understand the need and understand the impact by tying it to the experience of an individual or illustrating that gap through the experience of an individual. That remains important, but it's not enough in and of itself. We need to layer that now. And I think we've been doing that for years, but increasingly now, I think we need to layer that with speaking directly to evidence, using numbers, using numerical facts and dollars in terms of being able to speak to what the gap is, but also what the benefit is financially, and also in terms of the number of people that can be impacted when you deploy or integrate the use of these tools into your practice. I think it can be incredibly beneficial. And I think things like this, coming together like this to share the availability of the tool, is really important. But I think the ongoing conversation to share how the tool is actually being integrated into practice will further strengthen its and broaden its reach across the sector, and really reinforce the partnerships that we're all really interested in building going forward.
Thank you. This has all been really interesting, Gladys. Thank you. Don't leave us yet. We'll come back with some more questions. But I think that you're in a really great position to see how this tool might be beneficial for other nonprofits that are providing some of the direct services, as well as from a workforce development perspective. So I'd now like to turn it over to our next guest, who can speak to this last question a little bit more from a grant-making institution. So Colleen Desmond is the Senior Manager of Data and Learning at Interact for Health, which serves over 20 counties, or serves 20 counties, I think, right, Colleen? Yeah. Throughout Southwest Ohio, Northern Kentucky, and Southeast Indiana. They're working to ensure that people have a just opportunity to live their healthiest lives. And the work that they do is really focused on untangling root causes of unjust systems, and they are champions of trust-based philanthropy in their grant-making strategies. Colleen, it is so wonderful to have you here today to share your expertise with us.
Yes, thank you. I'm so excited to be here.
So I know that Interact for Health has also recently released a report, the Our Health, Our Opportunity report, that explains how social drivers of health are intertwined. So how does financial insecurity fit into this, affecting the health outcomes in our region?
Yeah, it's a great question. And I'll start by saying this Our Health, Our Opportunity report, I'll probably refer to it a lot. It's kind of my baby. I could talk about it until the cows come home, and I'm happy to talk more about it with people if they're interested. But I can also, it's free available. It's available for free online. So I can drop a link in the chat if anyone's interested in looking at that and learning a little bit more. But yeah, to your question, when we were working on the report, we spent a lot of time learning about and thinking about the vital conditions for health. So these are the building blocks that all individuals and communities need to thrive and reach their full health potential. That vital conditions framework encompasses 7 areas. So within that is humane housing, basic health and safety, a thriving natural world, reliable transportation, lifelong learning, meaningful work and wealth, and then belonging and civic muscle are kind of at the core of those. So it's been a really helpful framework for us to think about how we think about health in our communities. And something that really is kind of like at the forefront of this for me is that these connections are just so these conditions are just so deeply interconnected that it's really difficult to isolate the impact of just one factor. And I think financial security is a perfect example of that, right? So it's intrinsically linked to meaningful work and wealth and serves also as the means by which people can access those other vital conditions for health, right? So for example, if you don't have financial security, obtaining reliable transportation and humane housing can be really, really difficult. But at the same time, lacking stable housing and dependable transportation, that's going to hinder your access to meaningful work and therefore affect your financial security. So these things are just really, really intertwined. And we know that these factors are directly linked to health. So in the report, we did some analysis looking at the neighborhoods in our region that rate their health as the best compared to the neighborhoods where people rate their health as the lowest. And there were a lot of interesting differences. Again, I could talk about this forever, but just to share one that I think really ties in with this financial security piece is income, right? So the median income in the healthiest neighborhoods in our region is around $120,000 per year, which is 4.5 times higher than the median income of those lowest health neighborhoods, which is around $27,000 per year. So I think that just really brings home what a vital role this financial security piece plays in the broader picture of health.
Yeah, and so I appreciate you sharing that, because I think many of us can understand that, of course, financial well-being and physical well-being are connected, but it's so great to have some specific examples and some of those data points to Gladys's mentioning. It's having the evidence is so important. And now it sounds like this is a perfect kind of lead into the next question, because I know that Interact for Health has some of your own powerful data tools, like the policy map. So when we start talking about layering data, that I'm going to talk about your policy map. I think it's done a really great job of helping to inform our community. So I guess in your mind, what role do data like the policy map and the self-sufficiency simulator play in terms of making the case for this long-term systemic solutions versus the short-term assistance, which of course both are helpful and important, but how do we both think about immediate needs and the long-term strategy here?
Right. It's a great question. I think this doesn't answer your question, but I've been thinking a lot about this as like the river analogy of upstream, downstream. Like we've got people falling in the river. It's really important that we pull them out. Those things are super important, but it's also important that we figure out why they're falling in the river in the first place and stop that from happening. So, focusing on one over the other doesn't mean that only one is important, but I've been thinking a lot about that lately. So I had to say something. To your question, I think, data and equitable access to it are just really important for a lot of different reasons. So at Interact for Health, we believe that public data are a public good and that it's critical for understanding the factors that shape a community's health and well-being, also for making informed decisions and for knowing if our actions are making a difference in the long run. So we work to make sure that data is accessible to our community in a couple different ways. You mentioned Policy Map already. That's another one of my favorite things that I could talk about forever, and I'm happy to share more with folks about if they'd like. We have also collected a fair amount of primary data of our own at Interact for Health. So just as one example, the Community Health Status Survey is a regional health survey that we've conducted every 3 to 5 years, going all the way back to 1999. All that data is available on our website. There's a ton of other regional data sources that are really amazing, like the CHNA, Community Health Needs Assessment, that really help us get a broader picture of what's going on with health in our community, in addition to the self-sufficiency tool. So these data, I think another piece that is important, which you all spoke about earlier, is pairing the data with the stories of the people who are living in our communities. And that's really, really important to have the numbers, but also to have the context behind those numbers. So in the report, we made sure to try to bring in voices of people who are living in our region. And I pulled one quote that I just thought really helped sum up the importance of self-sufficiency. So this is a quote from a person living in a rural area in our region. They said, "The problem I have right now is that my job doesn't even pay me $2,000 a month. So how am I going to pay my house and my car and my insurance? The nearest large enough city to provide a stable income is 32 miles away." So, pairing things like that to give the context and the color of what's going on in the community, I think is really important. One of the things that I love most about Policy Map and also the Self-Sufficiency Simulator is that they make these really complex system data pieces accessible in a really user-friendly way. So that empowers people closest to the issues to advocate effectively for that positive change. So it allows for a more comprehensive examination of that entire system rather than just one isolated component that you could get on your own. Which I think helps enable advocacy for those more sustainable long-term systemic changes that address root causes. Another thing that I just have to make sure I mention here is that, as I'm sure a lot of people here know, our federal data infrastructure, which is how a lot of us access the data about our communities at the local level, is actually coming from federal sources, may not be as reliable as we had once thought it was. So I just think it's really important that as a community, we're thinking about, long-term, our collective data infrastructure. How do we work together to protect it? I don't have all the answers to that right now, but I do think the Self-Sufficiency Simulator is a great step in that direction of bringing this data to the people and making sure it stays accessible.
Yeah, thank you, Colleen. I want to kind of switch gears just a little bit and ask you, how does understanding self-sufficiency or health outcomes help inform grant-making decisions and investment strategies? Interact for Health is kind of a key player in our region with that. So how does this information guide decision-making from Interact for Health?
Yeah, one of the things I think is really cool about the tool is that it really helps us acknowledge the reality of what people are dealing with in our communities and their day-to-day. So I think we can all agree that we want all people in our region to be healthy and thrive, but we also know that there's communities and people who are facing unfair barriers that limit their ability to do that. And the simulator is just a really great way to uncover those barriers, which helps us as an organization, concentrate on efforts where we can actually have an opportunity to make a real impact and enhances our ability to be an effective community partner. Just kind of one example that stood out to me as I was looking at the simulator is there's noticeable differences across counties. You pointed this out in your demo earlier, where Hamilton County requires a higher income for financial stability, but there's also a lot more access to jobs, to public transit, to things like that, right? So these things are layered and interconnected, as we talked about before. So, looking at strategies that would work in Hamilton County versus strategies that would work somewhere like Adams County, which is also in our region, this tool really helps us identify what's going to be most impactful in those two different areas, which is super helpful.
Great, thank you. One more question for you, Colleen. Are there any trends that you're seeing in terms of the funding priorities that are related to economic mobility and healthy communities? Could you speak to that a little bit?
Yeah, so speaking in the health space specifically, in the spaces I'm moving in, I'm starting to feel like a broken record over here. It's just the growing recognition of that interconnectedness of these vital conditions. So again, leading to a more comprehensive view of health and a focus on longer term solutions. I would say along with that, there's kind of been this greater emphasis on community-driven solutions, which is an effort to make sure that those people closest to the problems are closest to the solutions. I think another thing worth mentioning here is shifting narrative away from individual behaviors. So things like diet, exercise, smoking, and shifting that narrative toward more of these collective community factors, things like self-sufficiency. There's a growing recognition, at least in the spaces I'm in, that those factors are likely more impactful to the overall health of a community than those individual behaviors that we were focused on so much previously. So I think this is evident even in our own grant, Making It Interact for Health, where we used to be focused on addressing tobacco, the opioid epidemic in school-based health centers. We're now looking at policy and systems change, building community power, and addressing mental health kind of from a more holistic view.
Great, thank you. I really appreciate you providing us with this perspective. And I think this gets us really teed up nicely to hear from another expert, as you were just talking about kind of self-advocacy and having information to advocate for yourself. We've got an expert in advocacy and policymaking. And so I will welcome our next guest and introduce Yvonne Sherrill to our discussion today. Now, Yvonne is the Chief Executive Officer of Ohio Urban Community Action Network, an organization with a rich history in advocating for policies that alleviate poverty and promote self-sufficiency. Yvonne is also a key leader in the establishment of the Economic Mobility Alliance Ohio, a statewide coalition dedicated to raising awareness and advocating for solutions to mitigate and eliminate those benefit cliffs that we talked about earlier. This alliance works to reduce disincentives to work and create a really seamless pathway to economic stability for all Ohioans. Yvonne, I'm so happy to have you here with us today.
And Travis, thank you for having us. On top of this is aligned with our mission for advocating for policies that alleviate poverty and promoting self-sufficiency. The Ohio Urban Community Action Network, is also the nation's oldest urban community action network. And this year, we're celebrating 40 years of breaking the cycle of poverty in Ohio. So thank you for inviting us to join the conversation.
Yeah, congratulations on that legacy of work. I love that. I learn something new every time I'm in a virtual room with you.
Thank you.
I know that advocacy efforts take a lot of careful planning and organizing. So when it comes to working with elected officials, what are some of the most effective ways to engage them in addressing these tough issues like reducing poverty and increasing economic mobility? This doesn't happen overnight, right? So share with us some of your thoughts on that.
Yeah, you're right, Travis. It doesn't happen overnight, and I appreciate your warm welcome. What some may know is I've been an advocate in Ohio for more than about 25 years, and I've learned some of the best. And there's a litany list. It's very difficult sometimes forging these kind of relationships, but I'll drop 3 nuggets here today. So 3 areas that I think are mostly important for engaging our elected officials, our lawmakers in very difficult and sometimes tough conversations. One would be building relationships. There's nothing like it. This is not a cliche. This is not just a quote or statement, but building those relationships, really getting to know your elected officials beyond the election seasons, beyond campaign seasons. We need, as community representatives, as advocates, as impacted citizens, we need to be the voice of our fate. And so building those relationships mean meeting with them in person, staying on their radar, becoming a source of credible information so that they can use that to help make good decisions on behalf of the people they serve. I'll give you a quick example, Travis. Back in about 2009 for the next several years after that, I was working as a policy associate in juvenile justice reform, and it was a very controversial time at that point. We saw crime, hitting skyrocket numbers, and the General Assembly was mixed. There were conservatives and those who felt like we need to be much more tough on crime, and then there was this other position in which we had entered into behavioral sciences. We were looking at brain development and how much that impacts our young people and the decision-making skills. And so during that time, we really wanted to kind of push for family reunification and diversion programs and trying to help keep our young people whole in the pipeline. And so what we did to build that relationship is we identified a champion at that time. And it was the former state representative, Tracy Maxwell Hurd. She was just absolutely amazing. And she took up the juvenile justice, as controversial as it was a difficult conversation to have. But because we provided her with step-by-step information, state-by-state comparisons, the data that she really needed to be able to have these difficult conversations, we were successfully able to pass House Bills 86 in 2011. And then Senate Bill 337 in 2012. And to this day, former State Representative Maxwell Hurd and I are very good friends. So again, building that relationship gives you an opportunity to identify champions. The other, I would say, is create memorable advocacy. Creating that kind of advocacy, because keep in mind, many of our elected officials, like us, they are most educated, most informed based off of their immediate proximity, their immediate radius. And so sometimes their lived experiences do not mirror our lived experiences or those of the people that we serve. And so we have to sometimes maybe get a little creative and create those kind of memorable advocacies. Two people that I would shout out that I've learned from under for the last 25 years. One is the late, great Gail Channing Tannenbaum. Anybody on this webinar, if you've been an advocate for more than a day in Ohio, you know Gail Channing Tannenbaum. She was, for 50 years, she advocated fiercely for child advocacy and for young people. And she would do it in a way that she would meet elected officials in impromptu, formats. She would use innovative forces to bring home compelling data to match those services. And then the other one I would say is our retired and the incomparable former executive director for the Ohio Association of Food Banks for 20 years, Lisa Hamler Fugit. I just remember this one time, Travis, in a public committee hearing. Lisa organized a number of state advocates and citizens across the state. She was testifying, and the folks showed up with paper plates. And there were messages about the need to increase funding for food security and for pantries and for healthcare, because we know that, as Gladys talked about, as Colleen talked about, we know that all of these basic needs, these services, they're intertwined, they're connected. You can't feed a child who can't learn, or you can't teach a child who's hungry. So they're all interconnected. And I watched Lisa over and over again in her career use memorable moments to create that kind of advocacy and compelling, matching the data with the human experiences. And then lastly, I would just say to deepen your engagement. As I mentioned before, many of our elected officials, they live the same kinds of circles that we live in. And so often that is a circle of people who kind of think like you. They may be of the same social economic background. They may be of the same educational attainment. And so without having a diversity of people who don't share our same lived experiences, we need to sometimes invite them to your constituent, your districts, invite them to your agencies, let them actually see what it's like. One of the things that I've always loved being a part of the Community Action Network is Head Start. And there is nothing, Travis, much more profound to see these elected officials from Congress sit in these tiny chairs in a Head Start classroom reading with children. They need to be in touch with their constituencies. So deepen your engagement by inviting them there. So those are three things: build the relationships, deepen the connection, and make sure that we're touching base in a way that it creates memorable advocacy for them.
Great, thank you and those are such clear little pieces for us to take with us. So thank you for offering those. Now, for other advocates like yourself, how might this self-sufficiency data strengthen the advocacy efforts that you're talking about for economic mobility or other topics? I know we're getting ready to go to the State House next week, and we're going to be talking about some of this. So how do you see this kind of running in parallels with each other?
So I want to, Travis, I want to echo both Gladys and Colleen. I think they teed it up quite nicely, right? This, the self-sufficient simulator tool, it is the ultimate storytelling tool. One of our deficits within our advocacy community is we don't tell a great job of how we are actually using scarce resources, limited capacity to actually lift people out of poverty. And so this simulator gives us an opportunity to collaborate with elected officials, our lawmakers, our funders, and help them understand walking in someone else's shoes. You know, I loathe the whole narrative around buying too many lattes, or no, what we need is livable wages. And the simulator shows that between education, awareness, that we can help instigate empathy. Empathy doesn't happen for all of us. And so sometimes we need the data and the storytelling to be able to marry one another, to give others who are not familiar or they're not as aware of those kinds of things. So I think that the simulator compounds the data, the strengths, our advocacy efforts, and those that are most impacted. It illustrates the realities of poverty. It emphasizes the awareness of policies, and specifically in our communities. When I looked at the simulator, and when I took it, just, you know, I was a former young mother. I was a recipient of public assistance. And when I took the simulator test, just if you think about just this year alone, minimum wage was raised to, as you mentioned earlier in your introduction, to $10.75. According to the simulator, putting in my own personal, again, going back to 30-something years ago, as a single mother of just one son, I would still have not met the self-sufficiency standards by $2,544.29 in Cuyahoga County. And that's, Travis, based off of the 2022 calculations. That doesn't even meet the 2025 calculations. So what I hope this tool does is it mirrors the way that we can progress, just like other states. I used to, you know, as a former policy associate for Voices for Our Children, one of our sister organizations, Voices for Virginia's Children, they successfully used their self-sufficiency simulator to advocate for the state's TANF authorization committee and use it as a way to set new eligibility guidelines. That's what we want the tool to be able to do. It's a companion to the advocacy work we do. The Human Service Coalition in Florida. We have 3 human service coalitions here in Ohio, one in Columbus, Cincinnati, and now Cuyahoga County. But the one in Florida, Travis, they issued a policy brief to use as the standard to examine Florida's human services sector from an economic and community perspective. Imagine the ways in which that we can use this tool as a way to tag on to not only just local government, but state government, and mirror some of those opportunities and those policies to help promote self-sufficiency. So I think this is a great way, not only on the local level, but we see that other states are, you know, very smartly using this tool to be able to interact with funders, elected officials, and as data to show the great work that we're doing within the human service sector.
Thank you. I want to ask you one quick question here before we try to squeeze in a couple Q&As here. So you've talked a lot about how advocates can use this information. How do you see policymakers leveraging this kind of data in terms of, you know, they are walking their own kind of tightrope walk, and so how do you see them using this information for making data-driven policy decisions?
That's a great question, Travis, and I'm very passionate about this. So let me be very clear. I am a firm believer that poverty in America is a policy choice. While some may consider it a wicked problem, poverty in America is a policy choice. Policies can either serve as a barrier or a helpline to self-sufficiency. And today we've been focusing our conversation because we appreciate the Women's Fund of Greater Cincinnati Foundation for leading this effort. Thank you for the work that you've all been doing. But what we know for sure is this will help us get at better policies that could mitigate the benefits cliffs. It can help support folks who are trapped in that ALICE space, the asset limited income constrained employed space. It can help us think through policies like increasing the publicly funded childcare minimum eligibility to 300%. And that allows us also to deepen our investments in the childcare infrastructure, another policy decision that we make. So yeah, I absolutely believe that poverty is a policy choice, but just real quickly, I would like to highlight just maybe 4 or 5 in the middle of this state budget process. One, I'm going to encourage everyone on this call, please consider advocating for the implementation of a refundable child tax credit for working parents with young children. This policy will help us improve our workforce labor. As you've heard from Gladys and Colleen, people want to work. People want to work. Poverty is not for the lazy. Folks work 2 or 3 jobs, so they want to work. But let's help remove those policy barriers. 2, as I mentioned before, let's make the publicly funded childcare permanent and expand it up to 300%, so that families that are right about, like maybe a family of 3 that are right about $77,000, they will qualify for additional support. Let's increase SNAP benefits for older adults who we know in these days and times, many of our families are living very unconventional kind of, and we have many more elders who are maybe caring for our young people. And then lastly, the improving the coordination between efficiency, access across all public benefits. That means Medicaid, SNAP, TANF, and WIC. This will give us an opportunity, as Travis said before, through the economic mobility, we could center the user's experiences. Again, poverty is not for the lazy. And if I don't have time for this, I can't continue to complete your applications for this benefit and this. Let's improve cross enrollment for those who are eligible. Let's optimize case management, and let's make it a lot easier when we're supporting policies that will remove some of these barriers for our families.
Thank you, Yvonne. This has been so great, and I really value your perspective on these resources. And I want to drop those 3 nuggets one more time: building relationships, meaningful advocacy, and deepening those relationships. Thank you. Great. Well, I'd like to welcome our other guests, just to thank them one more time for participating today. I have inadvertently and maybe selfishly taken up all the time asking these questions of our panelists. I don't think that we'll have time to take on any questions live, but I will just mention, I'll try to answer a couple quickly here. This data, which maybe you heard Yvonne reference the 2022 data, just last week we got the 2025 data, and so I dropped that in so we have the most current data on the simulator for you now. So it is updated with the most current information that you all have now. They update this on a regular basis, but maybe every couple of years. So we just got the 2025 data. The previous version was 2022. So we can expect more updated data soon. And it does take into account things like consumer price index for inflation. There's a couple questions in the chat about some of the mechanics of this. And I love that people are also asking some great questions about, what else can this tool do? Is there more? We want more. We're hungry for more information, better tools to make this work. So we think that this is one more tool to add to your toolbox, and hopefully it is valuable to you. But now I'd like to turn it back over to our executive director at the Women's Fund, Camilla Worrell, to close us out for the day.
I learned so much. Thank you to all of our panelists, Gladys Sahovey, Colleen Desmond, and Yvonne Sherrill, for coming on to talk about this today, but giving us their insight and also all the work that they do every day as advocates. I'd like to thank the Women's Fund staff on this webinar for making sure the logistics and everything is flowing really well. Our Women's Fund Leadership Council, Advisory Board, and specifically, I want to highlight our research committee, who's been walking along Travis throughout this process to make sure that this information is truly accessible and understandable. And lastly, to Dr. Travis Spies for his hard work in putting this useful tool together for all Ohioans. To close us out, I have three things I want to be in the forefront of your mind. The first is a quote from Nora Ephron, American journalist, writer, and filmmaker, who said, "I hope you will find some way to break the rules and make a little trouble out there, and also hope that you will choose to make some of that trouble on behalf of women." And so if you're looking for good trouble, a la John Lewis, make a little trouble. Please join the Women's Fund of Greater Cincinnati Foundation in Columbus for the Economic Mobility of Ohio, their Advocacy Day on Wednesday, March 19th, 2025. And you can contact Travis if you want to have more information about that. And finally, remember, as we talk about these issues, that we're trying to educate patiently, advocate passionately, with the goal to inspire others consistently. So thank you. Thank you so much for coming today, and have a great day.